Diabetes mellitus is a chronic medical condition that occurs when the body is unable to properly regulate blood sugar levels. This occurs either because the pancreas does not produce enough insulin, type 1 diabetes, or because the body's cells become resistant to the effects of insulin, type 2 diabetes. Insulin is a hormone that regulates the absorption of glucose, sugar, from the bloodstream into cells for energy or storage. There are three main types of diabetes: type 1, type 2, and gestational diabetes, diabetes while pregnant. When the body cannot properly regulate blood sugar levels, high levels of glucose accumulate in the bloodstream, which can lead to a variety of health problems. These can include damage to the eyes, kidneys, nerves, and cardiovascular system, among other complications. Diabetes can be managed with medication, lifestyle changes, and regular monitoring of blood sugar levels. Diabetes mellitus type 1, also known as insulin-dependent diabetes or juvenile diabetes, is a chronic autoimmune disorder in which the pancreas produces little or no insulin. This occurs because the immune system attacks and destroys the insulin-producing cells in the pancreas, called beta cells. Type 1 diabetes typically develops during childhood or adolescence, but it can also occur in adulthood. People with type 1 diabetes require insulin therapy to regulate their blood sugar levels because their bodies cannot produce insulin on their own. They also need to monitor their blood sugar levels regularly and make dietary and lifestyle adjustments to manage the condition effectively. Type 1 diabetes is less common than type 2 diabetes, accounting for only about 5 to 10% of all cases of diabetes. The exact causes of type 1 diabetes are not yet fully understood, but genetic and environmental factors are believed to play a role. There is currently no cure for type 1 diabetes, and treatment focuses on managing the condition and reducing the risk of complications. Diabetes mellitus type 2, also known as non-insulin-dependent diabetes, is a chronic metabolic disorder that occurs when the body becomes resistant to the effects of insulin or when the pancreas does not produce enough insulin to meet the body's needs. Type 2 diabetes is the most common form of diabetes, accounting for approximately 90 to 95% of all cases. It is typically associated with factors such as obesity, physical inactivity, poor diet, and genetics. It usually develops gradually over time and can remain undiagnosed for years. Unlike type 1 diabetes, people with type 2 diabetes may not need insulin therapy initially, but may eventually require it as the disease progresses. Treatment for type 2 diabetes involves lifestyle changes such as regular exercise, healthy eating habits, and weight management, as well as medications such as oral glucose-lowering drugs and injectable medications. Regular monitoring of blood sugar levels is also important to prevent complications associated with high blood sugar, such as damage to the eyes, kidneys, nerves, and cardiovascular system. Gestational diabetes is a type of diabetes that develops during pregnancy in women who did not have diabetes prior to conception. It occurs when the hormones produced by the placenta during pregnancy interfere with the body's ability to use insulin effectively. Gestational diabetes usually develops in the second or third trimester of pregnancy and typically resolves after the baby is born. However, women who have had gestational diabetes are at an increased risk of developing type 2 diabetes later in life. Risk factors for gestational diabetes include a family history of diabetes, obesity, a history of gestational diabetes in a previous pregnancy, and being over the age of 25. Treatment for gestational diabetes involves lifestyle modifications such as regular exercise, healthy eating habits, and monitoring blood sugar levels. In some cases, medication may be necessary to control blood sugar levels. Proper management of gestational diabetes is important to reduce the risk of complications during pregnancy and delivery for both the mother and the baby. The symptoms of diabetes mellitus can vary depending on the type and the stage of the disease, but some common symptoms include Frequent urination. People with diabetes may urinate more frequently than usual because high blood sugar levels cause the kidneys to work harder to filter the excess glucose. Increased thirst. As a result of frequent urination, people with diabetes may become dehydrated and feel thirsty more often. Fatigue. High blood sugar levels can make people feel tired and fatigued, even after getting enough rest. Unexplained weight loss. People with type 1 diabetes may experience unexplained weight loss due to the body's inability to use glucose for energy and the breakdown of fats and proteins for energy instead. Blurred vision. High blood sugar levels can cause the lens of the eye to swell, leading to blurry vision. Slow healing of wounds. People with diabetes may have slower healing of wounds and infections, as high blood sugar levels can damage blood vessels and impair circulation. Numbness or tingling in the hands or feet. People with diabetes may experience nerve damage over time, leading to numbness or tingling sensations in the extremities.